Hi everyone, today I am going to shed some light on PCOS, the most common hormonal reproductive issue of women of current generation. What does it mean by PCOS? PCOS means polycystic ovarian syndrome. Poly means multiple, cystic means water filled or may not filled with water, a sac or bump over the ovaries. Syndrome means a group of symptoms usually occur together. Based on the cause of the PCOS, it can be categorized into four different types. Number one is insulin resistance PCOS, second one is inflammatory PCOS, third one is adrenal PCOS, fourth one is post pill PCOS. To diagnose PCOS, there are three diagnostic criteria based on the clinical expression of high androgens. Number one is facial hair, increased body hair, and male type of hair loss. Second one is irregular menstrual cycles or ovulation or absence of ovulation. Third one is presence of multiple ovarian cyst in the scan. So 2 out of 3 these criteria is considered as a PCOS. Here one thing we have to observe, weight is not the criteria to diagnose PCOS, because whether the female is thin or fat, they can have the PCOS symptoms and then they can suffer from PCOS. So when we consider common signs and symptoms, usually irrespective of types, the females will be having facial hair or irregular menstrual cycles and may not present with multiple cysts over the ovaries. So when we look at the general signs and symptoms, the common symptom or common cause we observe is high androgens in female body. So what is the root cause for this? What is the cause for this high androgens? What actually happens in PCOS? Let's decode, because knowing the root cause is very important to prevent and to address the condition. So if we look at the why this hyperandrogen occurs, so all the animals including human beings have insulin receptors over the ovaries. So these insulin receptors give signals to the ovary how is the environment outside. So when there is high insulin in our body, it gives signals to the ovary. So when there is a high insulin in the body, ovaries produces too much, more and more androgens, that is a testosterone. So this testosterone circulates all over the body and causes the symptoms. And one more thing we have to observe is the females who consume genetically modified foods very oftenly, they block the enzyme called aromatase cytochrome P450, which is required for conversion of androgens to estrogen, which is a female hormone required by female's body. So this conversion will not occur, in turn results in more of androgens. And second point is at liver level. When ovary releases too much androgens, it should comes to the liver and then it circulates all over the body. At the liver level, it has to convert into, or it should bind to the sex hormone binding globulin, a molecule produced in liver. But when body is full of high insulin level, when there is an insulin resistance, liver is under stress because the workload of the liver increases. So at that condition, liver fails to produce that molecule SHBG, which should bind to the testosterone and helps in detoxification. But this process will not occur in PCOS condition. So results in more of free testosterone all over the body in females. So in turn results in more of free testosterone causing acne, hair loss, growth of facial hair, and irregular menstrualities or fertility issues in females. This is what occurs in PCOS because of high insulin or insulin resistance in female's body. Hope this was a useful information and value added information, because knowing the things what is the root cause is very important to treatment, to give treatment or to reversal the condition, because giving treatment for acne externally and If there is a fertility issue, giving treatment for that fertility issue is a different condition which is not going to help you without addressing the root cause. So knowing the root cause is very important while treating the condition. Hope this was a value-added information. If anybody looking for any preventive aspects or to reverse the condition, do reach out to us. Thank you so much.